Hello. Can you hear us, guys? Thanks, everyone, for coming in during this weather. I'm hearing that this is going to be one of the chilliest night of the season. Is that correct?
Oh, they changed it. It's not going to be that bad.
All right. And I saw some folks drove like 1 hour or more.
Yep.
Who is 1 hour and more? Man, amazing. All right. So what we're going to do is that we're going to talk a little bit about RagaAI. We're doing some really amazing work. Maybe 5 to 7 minutes. And then we have an amazing panel here. I'm really excited about folks on the panel there, and we'd love to hear their thoughts on a very important topic, which is reliability and compliance and safety of agentic AI. So we'll just start. Can you hear us on the Zoom? Can you just one second?
Yes, all is good.
All
Yes,
right.
we can.
Okay. All right. All good, Eric. We are good on this side. Okay. Fine. Thank you. All right, so the agenda is very straightforward. We are going to start talking about some of the exciting work we are doing from RagaAI perspective. RagaAI Catalyst is a platform that is enabling safety and reliability and compliance for AI and agentic AI, and healthcare is one of the focus areas for us. And then we are going to introduce our eminent speakers and just start the panel. So RagaAI founded a few years back, headquartered in Bay Area with a team in Bangalore. We started with a thought process of how can we find reliability and trust and making sure AI is something we can scale reliably. And that was pre-chat GPT or pre-LLM era. So we started with computer vision AI. And that was our first product called Prism. And then as agentic AI, Gen AI picked up, we expanded that into a product called Catalyst, right? And from there, Gen AI and agentic AI obviously is becoming a key focus area. So effectively, we have three platforms: Prism for computer vision, data and analysis, then Canvas to help build agents, and Catalyst to basically for making sure reliability and scalability of agentic AI and Gen AI. So there are significant gaps today when we look for testing and reliability of AI and agentic AI. Right? Today, LLM as a judge is used as a primary method, which is, for most part, is not sufficient. Right? We are just calling another LLM, and that has a lot of gaps when we start to look at testing as a methodology. Right? The second big challenge is when we talk about compliance. Several verticals, including healthcare, aerospace, life sciences, finance, require compliance from various perspectives, and that's a big gap that is not being filled today. Uh, Third very important thing is data protection and privacy. Right, so PII, PHI is a big area of concern when using AI and agentic AI. I was talking, I think, Doug, to you, right, and this is one of the key area that you brought up, right? So we'll talk more about that. And then how can we provide verticalization and specific capabilities for specific use cases and verticals like healthcare, for example. Right? So that's where that's exactly the four dimensions where Catalyst, RagaAI Catalyst comes in, right? Where we have very specific offering for compliance and guardrails. I think so. So we'll just talk at a very high level, and I will point to the web page. There's a lot of good details out there. Very specific offerings around PII, PHI, metrics and evals. There are a range of things that are available out there, but specifically from use cases and verticals, there's a lot of work that we have done there. And specifically the leaderboard, which is ranking LLMs for specific use cases and metrics, is a big area of interest as well. So we'll just play a quick video here and show you the program. Eric, I need your help there. Yeah, thank you. kind of show the full flow of our platforms from data quality, which is Prism, to build, which is Catalyst, to evals, which is so Canvas, and the evals, which is Catalyst. With that, I think we'll start our panel. Very excited to introduce our speakers. I'll start with Dr. Shyam. So, Shyam has over 20 years of leadership at Philips and Deep Health, where he has pioneered the integration of AI, artificial intelligence, into diagnostic, imaging, and clinical workflows. Today, he is the Chief Operating and Technology Officer at Radnet. He has directed transformative global initiatives in radiology, oncology, and enterprise informatics, driving scalable AI solutions that embraces patient outcome and operational efficiency. Please help me in welcoming Dr. Shyam. The next speaker is Dr. Shantanu. He's an esteemed AI ML scientist, entrepreneur, and leader. With extensive experience at MIT Media Lab, NASA, Meta, Airtel, and NatWest, he has architected AI and data platforms serving hundreds of millions globally and spearheaded multi-billion-dollar initiatives. A two-term founder and early member of Delivery, Mr. Bhattacharya drives innovation in product development and data strategies while serving as a globally recognized speaker on the future of Agentic AI. Please welcome. Then we have Vikas, who is the CIO of HealthDrive Corporation. He's a global technology and transformative leader. He currently serves as a global CIO at HealthDrive, driving large-scale digital innovation in healthcare. Vikas has built and modernized technology systems across regulated industries, including finance and healthcare. He is known for advancing responsible AI, enterprise modernization, and data-driven decision systems. With deep cross-industry experience, he brings a powerful perspective on the future of AI-enabled healthcare. So, Vikas. So to start off, I think there are mics here for this start. Mic there is, yeah. Let me start with requesting all the speakers to share their experiences of AI and agentic AI and how it connects with their current work so that we get the background of what they are doing in AI and agentic AI. Sure.
Yeah, thanks. It's a pleasure to be here and to be with esteemed folks. What we do, maybe just to give a bit of background. So we're a very large radiology company. So Radnet, the parent company, is a radiology services company. We operate 400 plus imaging centers on the East and West Coast, where we do imaging, MR, CT, all what you name it. And Deep Health is the digital health division of Radnet. So we build various tools, so informatics tools, software tools, etc. And one of the key things that we're working on is AI for automated assisted diagnosis based on the images. So right, so the first piece is not miss things on the images, because we find that, and we're also working on things where we're improving the diagnosis based on images as well, and then to create reports from those images. And therefore, there's a very high level of regulation in the space as well. And that's how we're working a bit with Raga here on looking at the safety assessment of those tools as we bring them into market.
Thanks. Yeah, Vikas.
Yeah, can you hear me okay? Yeah.
Yeah.
So Vikas Sixdeva, I'll follow Dr. Shyam's lead here, give you a little bit about our company first before I jump into the AI. So HealthDrive, we are a provider network. So we have about 600 providers who provide care to assisted living facility patients in there across 20 different states, across different service lines. So we have primary care, audiology, dentistry, behavioral health, podiatry, and whatnot. So our providers are locally really going to these facilities. So we don't have our own healthcare hospitals of our own, but our providers are going and providing care to those patients in those facilities. As we think about the AI, by the way, because we are a provider-led company, we need to focus on really making our providers as efficient as possible. So making sure that they have the right tools available on their fingertips, so they can actually provide the best care possible to the patient who are in the needs there. From that perspective, we are doing a lot of AI-related work. One is, of course, having an AI-led EMR. Capabilities like our providers can now talk to EMR versus typing in there, a summarization of their history and notes about their radiology, their labs, and whatnot in a single patient at a glass screen. It's all about medication reduction. It's about clinical pathways, finding the right treatment plans. Each and every one of these capabilities could be converted into an AI agent of itself, and across the whole life cycle of the clinical workflow and clinical decision support system that we are providing. And of course, we are doing things like, you're going to laugh on that, we still receive a lot of faxes in provider networks. So we are doing intelligent document processing, receiving faxes and converting that unstructured data into a structured data in terms of enrolling them, in terms of understanding what services they need from us and whatnot. So there are a lot of AI work that we are already doing and successfully in production with these systems.
Can you hear me? Okay, I teach so I can be loud even without a mic. I do a couple of things. I teach at MIT, one of the most sought after classes called AI for Ventures. And this semester was the Agentic AI for Ventures. I just came from there. Essentially, 38 teams, about 140 students built different types of Agentic AI companies, everything from healthcare to e-commerce, to helping people find rent and communicate better with their landlords. There's a plethora of explosions of companies that I saw this morning, which some of them are very, very interesting. I also am a researcher working for what we call is the Web 4.0. So how many of you, I'll just do a little bit interactive. Yeah, sure. How many of you have worked on Web 1.0? Black terminals, Unix, right? What is the command to connect to the web? I'm a professor, I can ask you. What was the command? Check shirt, whatever. Yeah. ATDT. Yes. Yeah. You have to remember the Unix commands. All right, sorry for putting you on the spot. That was Web 1.0. Then Tim Berners-Lee, who was also at MIT, built the Web 2.0, which was a transaction web, right? And that opened up about 30 trillion of economic value. Web 3.0 was the crypto and the first attempt to decentralize web, blockchain, crypto, and so on. But a lot of crypto scammers gave it a bad name. It sort of fizzled away. Web 4.0 is what we're seeing is the agentic web, right? So web will transform from being a transaction medium to, it will go from being a transactive web to an intelligent web, right? It's a cognitive web. That's the foundations that we are building. A web essentially needs four things, right? One is an endpoint like a phone, a communication protocol, a registry for discovery, and an application. So all those layers are being invented. For example, for endpoints, you have MCP. For communication, you have Google's A2A. What we are building is the top third and the fourth layer. MIT has typically done that in a non-profit fashion. The idea is to ensure that this doesn't get locked up like the app stores, right? Multi-$100 trillion Web 4.0 should not be locked up by 4 or 5 companies that you see today. That's my second job. The third job is I'm also a startup founder, have done 2 startups, sold the second one to Facebook as a solo founder. The third one actually went IPO, but I was not a solo founder and came about in Series B. The fourth one is what I'm working on. It's in healthcare space. It's taking the mundane stuff hundreds and thousands of pages of hospital records and turning them into codable bills. It's called, the exciting term for this is called ICD-10 coding. A lot of contextual document processing, initially document processing, but turning into a lot of contextual terms. Like, for example, if the doctor's report say patient complaints of chronic asthma versus patient has chronic asthma, the first one is your opinion, the second one is a medical opinion. So you cannot bill for the first one, you can bill for the second one. And there are hundreds of thousands of examples of that. And you're discovering a bunch of things that you need to really get right in the agentic web before you can actually build enterprise application. It's not easy, it's extraordinarily hard.
Thank you. Thanks a lot for setting the context. The next area that I want to definitely talk about is ROI for AI and agentic AI. There's a lot of good discussion, a lot of exciting work going on. But we have some of the best speakers with the experience in industry and academia. We'd love to get their perspective on what is their view for ROI in agentic AI. Yeah, Shyam.
I think there are multiple, paths to ROI, and I think we're seeing it already, right? I mean, I was just laughing when we were talking about. No. When Vikas was talking about the documents and faxes, because 90% of our orders come that way. And so we used to have a team of 45 people take these prescriptions and translate them into orders. And there's a ton of mistakes that happen because medical scripts are very complicated, and L's and R's, and knees and ankles, and you're now having folks that are not super trained in medical terminology translate that into orders. And so that's one of the first areas we've actually implemented complete automation in, where these faxes get converted. And so already right there, that's an example. But there are more advanced uses, right? I think we're using these tools also for things like auto report generation or preliminary report generation for radiologists, and it alerts them to various things that they should look for when they read images. And then, of course, there's the whole improving cancer detection, improving lung cancer detection, sort of the highest value things, right? A very simple example that we just recently published on in Nature Health is a study in breast cancer, almost 600,000 women, where AI agents on top of images have actually improved cancer detection rates by almost 21% relative to without these tools. So we're finding basically one additional cancer for every 5 we found before, and that means earlier diagnosis and better outcomes for these women. So it goes all the way, and I think there's this myth that there's no value, and we haven't seen the value and all this stuff. I just completely disagree with.
That's a great data point, actually, coming right from the industry. Thank you, Shyam. Yeah, Vikas.
Yeah, so Shyam, I completely agree with you, right? See, if you look at the ROI perspective, they're still the same dimensions and same levers that we are all trying to pull. One is improving customer experience, and in this our case is improving patient experience. Number 2, it is about how to increase the top line of revenue, if we could. Third is operational efficiency and effectiveness, and in other words, cost savings. And 4th is developing new capabilities that we haven't yet thought through. So if you take the 4 levers, it still applies to AI also. So if I translate all of that into for healthcare, it really is clinical, operational, and financial efficiency overall. Now, if I further translate that, it really gets down to, are we providing quality care to our patients? Number 2, are we doing it consistently? And number 3, are we reducing the cost of care, which is a big problem, right? So if I keep building upon that, introducing these AI features for our providers so they can be more effective and efficient in doing the work. So I agree with Shyam here that if we give them the right tools to diagnose the problem sooner, and if we help them reduce the medication, if we help them give the best differential diagnosis that they haven't yet thought through, if we give them treatment plans that they need to think through. All of those things could be converted into dollars and ROI. And this is just not about cost saving. This is actually improving the overall the top line also. Yeah. So to me, it's just not that. And last but not the least, there's an aspect of ROI that we all forget, which is reducing the risk, which is very, very important in healthcare when you're dealing with human lives, right? So we want to make sure that we are doing this responsibly. We are reducing the risk. We are improving the compliance that is absolutely necessary. So there are a lot of tools that are coming up in that space that actually really helps us provide the better quality of patient care consistently with keeping the cost down. And these are all ROI features to us.
That's great. And you are already adopting some of these technologies.
Correct. So we are already adapting all of these technologies that I've been talking about is AI first EMR. And I can't share it publicly, but we have been able to translate that into real dollars in terms of the top line as well as the cost savings for providers for us.
That's great to hear. Yeah. Yeah.
Does this one work? Yeah, perfect. It works. All right. So I, as a part of the way I teach the class, right, I also interact with a lot of VCs. So I'll give you the perspective. First of all, great perspective because your framework, I was just trying to remember next time I'll take notes. And Sham, great perspective. But I'll tell you about if you ever wanted to start a company, what are some of the things to keep in mind, right? From an ROI perspective. The VCs see tons and tons of this thing. Everyone saying, oh, I'll build an AI system. Autonomous healthcare. 100 million, I need 100 million Series A because I'm building autonomous healthcare, right? So everyone is saying that I'll build something AI that will be better than the human. In reality, it's the human plus the AI will be better than the human. You're not going to go build an autonomous system anytime soon. And there's a mathematical reason for it. Clearly, very simple mathematical reason. And I'll state that if you go to a doctor, there are about 50 data points. Your vitals, medicines, past, and all of that. And if you can bin each of them just into two states, blood pressure high and low, you're seeing a total number of 2 to the power 50 number of states, which is 10 to the power 18 episodes that you need as your training data, which is happens to be the same number of atoms that exist in the universe. So you're not going to get the only 10 point, about a couple of billion of us, 10 billion of us. Each of us need about 1 billion data points before you can build an autonomous system, right? So that's not going to happen. So you cannot even pitch that you go build an autonomous system. Your pitch should be human plus AI better than human, not AI better than human. That's number one. Number two, go for where the money is. I have a friend who used to send email to the CFO saying that I'm going to save you $2 million a year, I'm sure you're not interested. He said the reply rate from those emails are about 90%. Go for the straight line to the CFO. It's hard to break into that, but once you break in, it's very hard to kick you out. Number three, go for precision, right? You have to go for precision. So there's a company that was Massachusetts-based called Nuance. A lot of you, those who've been in medicine, have dictation, right? Nuance had a 95% accuracy, and it got killed because the human dictation, human transcribers were at about 97%. That 2% mattered. Nuance spent billions of dollars getting to 95, but never got to 97, right? That matters. Number four, what matters above everything else, especially in healthcare, a component of your ROI is the trust. Hallucination kills, right? If you're going to go use a general purpose LLM and expecting it to do better than anything else in the market because you're training data, that's not going to work out. You get 15-20% hallucination because you don't have enough training data. Is going to kill any business. No one is going to trust you. First time that happens, second time or third time that happens, you're out of the door. So there are specific ways you can work with those problems technically. Happy to get into that at some point in time, but catch me after this. I'll talk about it.
That's the next, I think, topic. And that's the topic of talent, right? So I think let's go deeper into that, right? So, so trust, reliability, and how can we make AI and agentic AI failure proof, right? We are all agreeing that this is an important technology. there's ROI, right? But there are risks, right? So we'd love to actually start something from you, right? From an academic perspective plus industry, right? You have both the perspective, right? What do you think?
What's the question?
The question is, right? We know the concern around trust, and right? So trust and reliability. So what is the part to make AI and agentic AI failure proof?
Perfect. I sat farthest away from you, hoping that I'd get the last question. I can listen to others and keep thinking about the answers. You just caught me on the wrong end. There's a reason. I really like you, Sam, but I didn't sit next to you so that I come last. All right. The way to do that, as I said, I'll just take one aspect of it, hallucination, right? Because what you're finding out, even if you're 85% correct, if the other 15% is something that AI says, I don't know, and throws to a human, there's a way to solve it. If you're 85% correct and AI is making up the other 15%, your business is dead. So the way you do is the only competitive, there are two competitive modes in any healthcare AI business. One is the private data, not public data. Everyone has Mimic for data. Everyone can go to Aspire. If you are academic, you can get some more databases, use your academic credentials and all. That's not a mode. It's a private data. For example, if you know a radiology team, and I'm just looking at my friends in radiology, or if you know a company that serves 4,000 providers, you could get the private data, of course, PI and master all of that. But the reality is that others can also get that. The one that I'm coming to conclusion that would give you better results than anything else is the ontology, is the nuances that I just talked about, right? If you can build an ontology that's better than others, which talks about, so for example, if you look at if an RN can sign a document or not, the Medicare says as long as the doctor is in the same facility, an RN can sign. Texas says the doctor should be in the same building. California says the doctor has to be in the same room. Unless you know those nuances, your and build the ontology to that detail. In California, between Anthem and BC, Blue Cross Blue Shield, for approving the same code, there are different rules, right? So people spend, how many of you have heard of Palantir? They're one of world's best AI companies because they spend billions of dollars in ontology in the topics that they deal with, right? So ontology, in my opinion, we have been starting to work on it. It's hard to do. It's extremely expensive. But the first guy who does a combination of, a small language model, SLM, specially tuned with private data, as well as a very, very good ontology. I think once you hit certain amount of accuracy and you have some 5% hallucination, I think that's the flywheel that gets built in. The humans in the loop keep correcting the output from the AI models. It goes back into your learning. That's where your ground truth comes. And I think that's where a lot of the work will happen to make AI more reliable, more trustworthy.
Okay. Yeah, Vikas.
So I'm not sure how many, and I will also ask you to raise hands, by the way, to make it interactive. How many of you will feel comfortable if an AI agent is really telling you to reduce your medication or maybe injecting a medication in you? All right, that's what I expected. So I would talk about the continuum of AI and how we are actually thinking about reliability and protecting the trust that Shantanu talked about. So if I start to think about assistive AI, we are providing, and I've been talking about that for the last 10 minutes or so, our providers, we are guiding them on making decisions. We are giving them the assistance they need to perform their job best, but ultimately still provide us decision. So this is really assistive AI. If I take that further into a fully autonomous AI in healthcare world, where we are dealing with human lives, I think we are going to be a little bit hesitant implementing it. So to me, as assistive AI, when it comes to dealing with human lives, is where we stand today. But in the back office functions, like deploying an intelligent document processing, with a 97% accuracy or 96% accuracy, I think we can deal with that 3%. We could apply human in the loop to correct those and try to get up to 100%. And in addition, I think I always talk about when I got challenged on the accuracy levels of being around 95 or 96% with intelligent document processing using that as an example. I say, okay, let's go back. Let's look at the humans who were performing that job before we implemented that. What was the error rates at that? 17%.
Wow.
So we reduced that from 17% to about 4% error rates, and you are complaining about that, but we can deal with that error rate, or we can apply human in the loop. But when it comes to protecting the lives, I think it's going to be a few years before we actually can take that fully autonomous path.
Wow. I will change the question a little bit for Shyam, actually. So we have actually, RagaAI has been working with Deep Health and Shyam and his team, right? And what we have found is that they are one of the fastest moving healthcare companies that we've seen, which is really amazing. So the question for Shyam is that how you are able to move so fast when a lot of the healthcare companies are very conservative, right? And how do you bring the aspects of reliability and ensuring that everything is working fine all the time? I guess would love to hear your perspective. Yeah,
it's a great question. I actually, this is now unfair because now I've had to answer a new question every single time. And these guys are. I was really thinking of a really good answer to that previous one.
I think I'm going to get the next question right.
No, it's actually a great question. It's very linked to what we just talked about.
Yeah.
One of the advantages, I think, Santana made a really interesting comment, which is, everybody talks about just having the data. You have to have some knowledge of the data, ontologies in one case, you have annotations in another, with vision. I think these are really important pieces. But I think one of the reasons we're able to go fast is getting it close to maybe a little bit better than the human, just a little, not at 98%. And I can put it because we're a provider enterprise.
Yeah.
So I can put it in the field.
Yes.
Right? And then I can then get the data back, get the feedback, and then we can improve. So one of the things that we're in this sort of era of the AI, human in the loop, is as long as I'm getting better, right? I don't have to get perfect, but as long as I'm getting better, we can move it forward. And so that's been, I think, our secret sauce, right? We put breast cancer detection, into the field almost 5 years ago. The stuff that was there was awful, right? People would actually turn it off because it would light up everything, on the images. And now it was a little bit better. And then now I get people complaining, it's picking up these breast guide wires, can you just get that done? And then we put in, we train a model on that, we identify it, we remove it. So, it's this process. And I think that's been really interesting. And I think it's going to be very, that's why you also see now more in our world, end users doing the model building, right, or the fine tuning, or the intermediate training, and I think that's a significant advantage in today's AI era. And I think that's going to, and that's why I'm really curious about how the startup world is going to connect to this end user world, because that's how we're going to get speed, right? And maybe I don't know if I can ask a question.
Please go ahead.
By going through people like you and me.
I think that's a great point, right? Basically, startup and mid-size and larger enterprises are moving at different paces, right? So I think, how can we bring learnings from the three things, so that, right? So I think that's the question probably for you.
That was supposed to be Vikas this time.
But I think in general, what we have seen from our experience is that a lot of good work is happening across companies, different sizes. But there are, because of various reasons, there are hesitations. And some companies are able to move faster, right? And actually, Deep Health is one of the amazing companies which I will do that really well.
I can give that.
Yeah. Okay, go ahead.
If you ask me. So startups have two advantages, right? And of course, the bigger companies have maybe 100 advantages. So startups, when they screw up, very often they don't know they have screwed up. So they can correct themselves very, very quickly. Then when they realize that I don't have, like my last job was a large bank CTO. The amount of time I spent with legal before I could do anything was phenomenal. My time was spent, I had 2,200 engineers and I did zero engineering work. A third of it was HR, a third of it was stakeholder management, a third of it was compliance and discipline, maybe 2%. In a startup world, that flat structure and the ability to go build something quickly exists. So the speed of iteration is a big advantage.
Definitely.
Right? Second thing is that a lot of the startups, not particularly in case of me, because I'm sort of unique in from being startup and academia at the same time, but a lot of startups actually work with academia. And there, what they have two things, right? One, people who are in their 20s, right? So when I was 25, I used to hang around with people who are 55 because they made me uncomfortable. Today, when I'm 55, I hang out with people who are 25 because they make me very uncomfortable, right? In a good way, not, you know. So that advantage of having young people who think very differently than us is a great advantage that startups have. And the third one is that you have to be at it, that you have to keep going after the customers. You have to have the first set of customers who will put their faith on you, let you pilot. But that whole sales and marketing, the legwork that one used to do that used to cost about 30% for a startup, has actually collapsed because of Agentic AI. One of my students have built a system where they're prospecting, right? He sent out 98,000 emails and he had a reply rate of 1/3. I've never heard of someone at scale getting a 33% reply. So a lot of the agentic infrastructure that's being dealt with, if you're really dealing with on every day, you are actually reducing a lot of the friction and a lot of the cost. That's the other advantages you have in order to that you can use to reach to your customers. So these are some of the toolkits that we're using. Largely experimental, so no definitive answer yet. You just have to iterate faster than others. That's about it.
That makes sense. So thanks a lot. Kaz, next question for you. Wearing your CIO hat, right? So as a CIO, you are evaluating vendors' solutions all the time, right? Which is best for your organization. So how do you, like, what different lens you use when you're looking at agentic AI solutions? And how do you, or like, what is your perspective of bringing them in your organization?
Yeah, so I will build upon what Shanti was saying. Sham also touched upon. We are a healthcare organization. Our core business model is to provide health care. We are not builders of the technology. Therefore, it's important for us to partner with those startups and the ecosystem because we are not the builders, but we are very good in partnering. We do have the data. We do have the patient population to test any models that we want to develop. But the startups or the technology companies like yourself, Gaurav, Raga, has to provide us the know-how, the technology to partner with us in deploying those solutions in productions very, very fast. So we are always intrigued by where technology is going. We are experimenting as fast as we can. We believe we are actually one of the, looking across the portfolio of the provider networks, we are far ahead in terms of where we are using AI. But other industries, of course, are going to lead the way. And that's cross-industry validation and learning is very, very important for us to learn from in the healthcare also. So those are some few perspectives from my side.
All right, no, that's exciting. So what we'll do is that, interest of time, we'll do a quick rapid fire round where we are going to ask a few questions and the answers have to be short and quick, right? Is that okay? All right. And then we will open up for audience for questions. So yeah, the first question is, what is a technology that you see become the most important in the next 5 years?
Can I say the next 2 years?
All right, next 2 years.
Actually, I'm going to was just struck by that. I think post-training tools in terms of this space. I mean, I don't. If you want to say what technology I think is going to be pretty paradigm changing, I would probably say moving into some of the robotics things that we're doing in healthcare. But if I was focusing in this space, I would say tools around post-training, because that's going to speed up that feedback loop to get to the 5%, the 3%, the 2% inaccuracies that we're trying to get to.
Okay, great.
Again, we are in this topic here, so I think we are going to see a lot more autonomous AI agents in the back office, in healthcare, and across the industries.
All right.
So what? Yeah. So I am thinking, hey, in 2 years, 5 years, no one knows. 5 years, we could all be working for AI. So these are the small models, sub-3 billion, sub-billion parameters model with really good reasoning capabilities that run on a Mac and hopefully on your iPhone, right? And they do better retrieval than others. They have better ground truth because of the ontology, and they perform better than GPT-5. Very, very custom deep models. Think of today's effort has so far been horizontal models.
Yeah.
I think the deep model will, small
Specific
deep,
knowledge,
would probably start solving real hardcore business specific problems in be it healthcare, be it logistics, supply chain, be it in robotics, and any of these areas.
I would just add very quickly the reasoning also, right? All the HIPAA, PCI, any other compliance reasoning built into those models, along with, of course, the ontology and whatnot, is going to drive their value.
Yeah. Okay. All right. The next one is favorite AI app or agentic AI app. Speak just one. Which one?
Open evidence.
Open evidence. All right. Perfect.
I would say there are way too many. And whatever drives value for your organization is the best technology out there, and that may be different for everyone.
Okay.
That was
For your choice, yeah. Shantanu, what is your choice?
Berkeley function calling model. BFCL. You actually have like real life data.
Yeah.
To see how your models have performed.
Yeah.
You can call a function and produce results.
Yeah.
That's one. I know anyone had used the web arena. Web arena gives you a realistic, web to test out your products. And then agent bench for agent markets.
Okay.
So those are the three. Did you say one?
No, it's okay.
I said one for each of us.
Yeah, one for each of us.
By the way, I'll add that because you were just talking about that one more. And you touched upon it. That's the edge computing, right? Just having the model run on iPhone.
Yeah.
And especially with the data that is in context on the moment you are running. I actually know one of the guy who's building that. So
other than our group?
Yes.
Our group at MIT actually works on sort of one.
So that's a very interesting one because we do have providers going into the facilities. Again, believe it or not, some of these facilities still don't have a working Wi-Fi, or we don't have the right infrastructure to be able to connect to a cloud-based LLM to really drive those insights. So having those local LLMs is actually neat.
Correct. One of the things that I was talking to, like, as I said, we are building something for ICD-10 coding. So one of the CIOs in home healthcare essentially said, look, you need to think beyond just providing us a model. He said, the workflow, which goes from someone taking notes, that get transcribed, someone putting them together in fax and God knows what other format, sending it to a third-party provider in Kansas City, Missouri, or Bangalore, India. This is why can't you just take 5 years backward? There's an equivalent of tiny Bloomberg terminals for all the data gets captured by the nurse practitioner, and it gets processed on the edge. And then whatever is not processed on the edge, send that to human. That I thought was a very different way of, I really liked the way he was thinking about saying that, look, why do you have to send everything to a central processor, do things on the edge, and take the differential and send it out to the third parties?
I know this was supposed to be rapid fire, right?
Yeah. So I think so one question I always ask everyone, what's your favorite AI conference? Okay, because a lot of us wants to go to the best conferences. I know Shyam's answer. Yeah. Go ahead.
New Rips.
Huh?
New Rips.
Did you go there?
No, it's supposed to be today,
It's
right?
happening, actually. It's happening.
right
New
now.
Rips is a good
Yeah,
one.
yeah. It's becoming a bit of an unwindly, but still one of the best. So.
Okay. All right.
I do a lot of different conferences, just not AI. So I just attended Gartner one very recently.
Yeah.
And the interesting part is they would talk about business, leadership, the next 10 new technology trends that are coming and whatnot. Typically, all these years have been going there. This year, of course, it was all about AI, and agentic AI. So yes, that's the topic becoming very important these days.
Yeah, to be honest, I really enjoy all the hyperscaler conferences because they bring people, technology, new thought all together. And if you can really put yourself there, you can really think about what the possibilities are.
Okay, I think that's a great point.
Thanks for bringing that up. I missed it.
Yeah, hyperscalers.
I mean, I was thinking from my academic hat, but I enjoy the hyperscaler.
Yeah.
They tell you how to do things.
Yeah, the reinvent is happening this week. Right?
Actually, I was going to say reinvent is happening right now. Google Next is happening.
So is the see all of us sacrifice those events to come for your event. Your event.
For our audience. Yeah. I think so 2 more questions. Favorite AI leader? Sam or
Favorite AI?
AI leader. Who is like the AI figure? Anyone?
I can do it. I know him very well, so it's a bit of a bad. Ian LeCun has done things that are contrarian, and I like people who are contrarian. They'll come through a curveball.
Yeah.
Because the world needs people who will throw curveballs.
Yeah.
Today he's saying that none of the LLM models will work 5 years from now, and we are doing the LLMs in the wrong way. Transformer model is the most inefficient. A bunch of things he's saying. Either he's getting too old, or he is really right, and in a few years we'll see a world and say the guy was right.
Okay.
No one is my favorite right now.
All right. Okay. All right.
I was going to say that, but I think a critique of the AI world is kind of more maybe where I'm coming from. Contrarian views. I think Hinton is doing that now.
Mm-hmm.
He let the genie out of the box, and he's out there pretty aggressively commenting on that.
Yeah.
I don't know if it'll ever go. It's not going to go back in, but we do need some proper critique of them.
Yeah. Completely. Yeah.
Both Hinton and David Sasabi taught in our class. Both of them, to some extent, are also contrarian. Yeah. You have to listen to people who don't think the way you do. My 55-year-old and hanging out in 25 years was for the same reason. I don't want the echo chamber where all of us are saying the same thing, right? If all of us are saying the same thing, there's a high likelihood that all of us are wrong.
Yeah. Last question from me. Why, and this is happening in Boston, so I have to ask this. Why do you love Boston?
I'll start.
Yeah.
So,
assuming you love Boston.
Yes, Boston, of course. I always say had brains, innovation going on here. Healthcare, of course, is so important here in Boston area. And most importantly, you get to see all weathers, including that frigid weather happening today.
Yeah.
And that's what builds the bondings. That's the reason why we are all here together. So this is a fantastic place, and I wouldn't trade it for any other city.
Great. Yeah, go ahead.
For this, I mean, seriously, like you could go out. I've been here 30 years.
Yeah.
And you can, people will drive 1 hour, 2 hours, whatever, to come have pizza and hear 3 of us speak and really learn something. And I mean, I think it's fascinating. I mean, every time I do one of these things, it's such an interesting ecosystem, especially if you think about healthcare, technology, where a lot of us are. There's no better ecosystem on the planet. And so it's something I really enjoy.
Plus the intersection of industry and academia.
Yeah.
Okay, so I live both in the left coast as well as in the east coast. So when I lived in the valley, right, everyone was talking about 2 things: the stock options, what is the next hottest company, and where's the biggest house, right, etc. And what zip code, right?
Yeah.
If as you come to Boston International, right, honey, there's an announcement that I heard some time back, and it plays regularly. He said every day people from all over the world come here with one objective to good for the humankind. We expect you to, do whatever, that ethos and all of that. Good for the human. When my broker lost a lot of money at one time, he told me, hey, I was doing my job in New York City. I don't enter the Wall Street saying that, what can I do for your clients? What can I do for my clients? I walk in by saying, how much money am I making today? Boston is one of the city where good people get together to do good stuff. They worry less about the outcome. In the other cities, people work from outcome backward. In Boston, people work from good work forward, right? That's the reason 18 square kilometer of Cambridge, 254 Nobel laureates. If Cambridge was a nation, it would be number one, followed by US, right? That's the reason I like it. And people are accessible, humble. Right now there are 18 living Nobel laureates in Cambridge.
Yeah.
You can pretty much walk into anyone's office and have a chat. Nowhere else in the world that ecosystem exists.
Yeah. I'm going to note those stats for next time.
Yeah.
When I go to West Coast.
The left coast, you mean?
Yeah, the left coast.
And the food and coffee is also really good.
Yeah. Which are the food and food in Boston sucks.
Oh my
yeah, I wouldn't agree with that. The food in probably DC is better, and New York is better.
Anyone is better. Atlanta is better.
All right. So okay, so with that we'll open up questions. Any questions from the audience? Yeah. Yeah.
So hi, so I'm Aditya. So I'm just doing my master's in AI back at Northeastern University. So yeah, and I'm here with my roommates. So, yeah, I probably think we are the only students here right now.
So we have a few more actually.
Oh, actually, oh yeah. Hi. All right. So my question was into the healthcare sector. So back when I was in the undergrad, so we had this opportunity where we were given the chance to build like a predictive AI model to and to say, for example, like to detect whether women will be able to, whether women will get, suffering from PCOD will get ovarian cancer or will suffer infertility in the future. But we weren't that informed, so we were like that experts in AI. So we just built with a normal CNN version with let's say a 7-layer model. But I just wanted to ask, like, how far can we improve it in the future so that like we could bring it a step forward? Because now when we talk about agentic AI and everything, people usually, they say when they come to agentic AI, they usually say like, okay, fine. So when you go into agentic AI, it's like you're gonna say something which is gonna happen in the future, but the term predictive AI has gone lost. So I just want to ask, like, what would really be the reason for that? I know it sounds a bit vague, but
it's a great question. I think we're in the era of brute force, right? Which is just, I have all the data, I have everything, I can churn it through some multi-layer technique, and then I can get out a result. And some of these problems are much more scientific based. They're more they have different ideologies that we don't still understand, and you can't brute force those things, right? So I think, and I appreciate your question, because in our world we are exactly there, right? Because you have to know what problem you're asking. You have to be able to cohort the right set of data, because if the data has noise based on a hypothesis of what things are going to predict what things. Like, I'll give you a very simple example. Take something like mammography, right? I can just churn a bunch of data and try to see if I can get a better predictor, or I can group data based on follow-on outcomes, biopsy results, risk, stratifications, etc. I would get a much better result in a much simpler CNN than if I just brute forced it. We're seeing it now, right? So I think your point is very valid. It also, to me, I think the big lesson is you have to learn AI and AI capabilities, but you have to know the domain as well to be able to have significant outcomes.
I was going to say the same thing in a different ways, though, right? Sometimes we take the technology, we go after solving a business problem without understanding the business problem first. So to me, it is identify the business problem, identify the use case, then you apply the technology to solve for it, right? If you take that angle and you know the outcome that you're driving, for, then you have the data, then you have the tools, then you can actually improve upon it because you know what your target is. If you don't have that target and business problem well understood, it becomes a technology experimentation. And I'm sort of a technology as well as a business leader in the organization. I always look through the ROI angle first, in the business problem first, before I look for the technology.
I can add a little bit, but
Yeah, sure.
both of them covered it very well. So think of this, I call it the token-based outcome versus intelligence-based outcome. If you're looking at a broad model like GPT-4 or so, right? The outcomes are largely token. It's probabilistic outcome. If you don't ground it in the truth, and that's the reason why I was sort of going on and on with the ontology, you have to ground it in the truth. Because otherwise, see, token-based outcome is not bad. It actually produces poetries or paintings that are unreal, right? You could not go, a unicorn jumping on moon, right? It produces proper images or visible images of that. But that also kills it when you come to the practical. So you have to be very, very careful when you use. You have to something like an LLM for a vertical use case. You really have to build a knowledge base, spend all of that time doing that. And even for the edge cases for which you don't have training data, I talked about, right? 10 to the power 18 is the order of magnitudes of data that is needed to build an autonomous, autonomous healthcare agent, right? You have to have a human in the loop for the foreseeable future in many, many of the spaces. Just there's not enough training data in the world.
Thanks a lot. I think we're out of time. I think speakers will be here for some more time if you want to interact with them. Right, with that, would love to really thank our amazing speakers, Shyam, Vikas, Shantanu, for their time and their valuable insights. Thanks a lot for being here. Really appreciate it. Thank you.
Thank you. Thank you.
I think you gave it a hang of some more. Yeah.